Difference between quadriplegia and quadriparesis. If you suffer from a traumatic injury, it is essential to learn the difference between quadriplegia and quadriparesis. Basically, quadriplegia refers to complete loss of function in the legs, while quadriparesis is weakness in all four limbs. If you're not sure whether you have either of these conditions, ask your physician about the best treatment options. You can also ask your doctor about the different types of mobility aids and other assistive technologies. Although you can't feel pain with quadriparesis, it is possible to deal with the symptoms of this condition. While a person is not able to feel external sensations, they may have pain in their internal structures. During this stage of your injury, a doctor will prescribe pain medications to help you get through the difficult recovery process. Your doctor will determine the underlying cause and the appropriate treatment for your situation. In addition to spinal cord injury, there are other causes of quadriparesis. Cerebral palsy and strokes can also cause the same level of impairment. The extent of damage depends on the part of the spinal cord affected and how severe the injury is. Your body's central nervous system includes the brain and spinal cord. If any of these areas become damaged, the signals they send will not work correctly and can result in quadriplegia. In most cases, treatment plans for quadriparesis depend on the underlying cause of the disorder. In some cases, immunosuppressive drugs will be used to treat an autoimmune condition or an infection. In other cases, a mobility aid may be prescribed. Depending on the cause of quadriparesis, your outlook will depend on the severity of your quadriparesis. While some patients will recover mobility after surgery, others may not. The difference between quadriplegia and quadriparesis is crucial to a person's quality of life. The condition can affect every part of a person's life. A person with this condition may have trouble walking, balancing, or moving. They will need assistance with daily activities. The condition can affect a person's emotional and social well-being. The differences between the two types of paralysis are not the same. The diagnosis of quadriparesis is important because it can cause a person to be completely unable to walk. In this case, the person's mobility may be limited to walking, crawling, or even standing. However, they can be helped with occupational and therapy. If a patient has both conditions, they'll be able to work as normal. When the cause is unknown, a treatment plan will be necessary. A person who has quadriplegia should see their doctor right away to determine what type of therapy and equipment will be most beneficial for their recovery. If you're experiencing any of these symptoms, it's vital to find a doctor who specializes in these conditions. The cause of your condition can affect the way you live your life and how you move your body. For example, a person with cerebral palsy may have a weakened neck and weak muscles. If a quadriplegia or quadriparesis affects both the legs, he or she will have a limited range of motion. In fact, if your symptoms are caused by a traumatic event, your doctor will likely recommend surgery. Fortunately, treatments for these disorders can be tailored to your specific needs. The best way to cope with a traumatic injury or illness is to get the right treatment as soon as possible. If you are unsure of what you have, your doctor will perform a thorough examination. An electromyography will measure how much function your legs have. Other tests will determine the severity of your injuries, such as spinal stenosis and a stroke. For those with cerebral palsy, a medical team may recommend a course of treatment that will improve your condition. A specialist can determine what is causing your symptoms and then suggest the best approach to follow. A doctor will perform a thorough examination to determine the cause of quadriplegia. This will include a careful assessment of reflexes, muscle tone, and ability to move. A neurologist may also order a series of tests, such as genetic testing and nerve conduction. In severe cases, a surgical procedure can be performed to remove the bulging cervical disc or decompress the spinal cord.